1. Laminitis, founder. What it is? Laminitis is the inflammation of the sensitive laminae, the interlocking tissue layers that bond the hoof wall to the coffin bone, pedal bone/P3, inside the hoof capsule. Causes: grain overload, carbohydrate overload, lush grass/high sugar pasture, pasture-associated laminitis, obesity and equine metabolic syndrome, EMS, Cushing's disease, PPID, retained placenta in Mares, excessive concussion, road founder, systemic illness or toxemia. Signs: classic sawhorse stance, weight shifted back onto the heels, digital pulse, bounding/strong in the digital artery, heat in the hooves, reluctance to move, walking on eggshells, rings on the hoof wall, chronic, called founder rings. In severe cases, rotation or sinking of the coffin bone, visible on radiograph. Treatment: deep bedding, sand or shavings, for comfort and support. Removal of the dietary cause. Anti-inflammatories, phenylbutazone/bute. Veterinary consultation. Radiographs critical. Corrective shoeing/frog support. Management of underlying conditions, Cushing's EMS. Prevention: limit access to lush spring/fall pasture. Avoid grain overload. Maintain healthy body condition score, BCS 4 to 6. Regular farriery. Two, thrush. What it is: a bacterial infection, primarily Fusobacterium necrophorum, of the frog and surrounding sulci, grooves, of the hoof. Causes: wet, muddy, unsanitary stall conditions, infrequent hoof picking, lack of exercise, reduces self-cleaning mechanism, deep central sulcus conformation. Signs: black, necrotic, dead, foul-smelling material in the frog sulci, soft, crumbly frog tissue. Lameness only in severe cases, when it invades sensitive tissue. Treatment: clean and debride the affected area. Farrier removes necrotic tissue. Topical antiseptics, iodine, copper sulfate, commercial thrush treatments, e.g., thrush buster, white lightning. Improve stall hygiene and footing. Increase exercise. Prevention: pick hooves daily. Keep stalls clean and dry. Routine farriery every 6 to 8 weeks. 3. White line disease, CD toe. What it is: a fungal and/or bacterial invasion of the white line, the junction between the hoof wall and the sole, causing separation and deterioration of the inner hoof wall. Causes: wet environments, poor hoof quality. Hoof wall separation from any cause allows entry of organisms. Signs: crumbly, chalky, powdery material when the white line is pared away. Separation between hoof wall and sole visible at the toe. Hollow sound when hoof wall is tapped. Usually not lame unless extensive. Treatment: resection of affected hoof wall by a farrier, exposure and debridement. Topical antifungal/antibacterial treatment. Shoeing to protect and support the hoof. Keep hooves dry. 4. Navicular disease, navicular syndrome/caudal heel pain. What it is: a degenerative condition involving the navicular bone, distal sesamoid bone, navicular bursa, and associated deep digital flexor tendon, DDFT. Causes: conformation, upright pasterns, small feet relative to body size. Improper shoeing, long toes/low heels. Hard work on hard ground. Genetics. Signs: bilateral forelimb lameness, both front feet. Pointing, resting one foot forward when standing. Stumbling. Short, choppy stride. Positive response to hoof testers, pressure over the frog/heels. Positive flexion test. Diagnosis confirmed via radiographs, MRI, or nerve block, palmar digital nerve block, PD block. Treatment: corrective shoeing, egg bar shoes, heart bar shoes, raised heels to reduce DDFT tension. Anti-inflammatories, bute equiox. Isoxaprine vasodilator, debated efficacy. Bisphosphonates, OSPOs, Tildren, in more recent protocols. Palmar digital neurectomy, nerving, last resort. Joint injections, navicular bursa. Prevention, proper hoof balance, and regular farriery. Avoid conformation extremes. Avoid excessive work on hard ground. 5. Canker. What it is: a chronic, proliferative overgrowth, condition of the horn-producing tissue of the frog, sometimes extending to the sole and bars. It is distinct from thrush. Causes: not fully understood, associated with poor hygiene and wet conditions. Draft breeds appear predisposed. Signs: cauliflower-like, white/gray proliferative tissue growing from the frog. Foul odor. Tissue bleeds easily. Lameness may or may not be present. Does not have the necrotic, black rot appearance of thrush. Treatment: surgical debridement under sedation or anesthesia. Topical treatments: metronidazole, chloramphenicol ointments. Bandaging: prolonged treatment, very difficult to cure, high recurrence rate. Environmental management. 6. Hoof abscesses, subsolar/subwall. What it is: a localized pocket of infection, pus, within the hoof capsule, either beneath the sole or hoof wall. Causes: bacteria introduced through a puncture wound, white line, or sole crack. Seasonal changes: dry to wet weather softens the sole. Bruising that becomes infected. Signs: sudden, severe, often 3 to 5 out of 5 lameness, may look like a fracture. Bounding digital pulse. Heat in hoof. Horse may be non-weight-bearing on the affected limb. Treatment: soaking in warm Epsom salt water to draw the abscess. Hoof testers used to locate the abscess. Farrier or vet pairs and opens the abscess tract to drain. Poultice applied, animal intex, ichthymol. Bandaging to keep clean until opening seals. Tetanus prophylaxis if needed. 7. Quitter. What it is: a chronic infection of the lateral cartilage of the coffin bone, collateral cartilages, forming a draining tract, fistula, through the coronary band. Causes: puncture wounds, wire cuts, or injuries to the coronary band/pastern. Treads: horses stepping on each other. Signs: draining sinus tract at the coronary band. Swelling of the pastern/coronary region. Lameness. Chronic, difficult to treat. Treatment: antibiotics, long-term. Surgical debridement of infected cartilage. Guarded prognosis. 8. Contracted heels. What it is: a narrowing of the hoof capsule, particularly in the heel region, compressing the frog and internal structures. Causes: improper shoeing, too much heel, excessive toe length, lack of frog pressure/contact with the ground, inactivity or stall rest. Compensatory response to pain: the horse avoids heel loading. Signs: narrow, tall hoof capsule. Frog appears small and underrun. Heels close together. May cause secondary caudal heel pain. Treatment: corrective shoeing to widen the heels, open-heeled shoes, egg bar, allowing frog contact with ground. Barefoot management in mild cases. Address underlying pain causing the horse to avoid heel landing.